Hello and good afternoon. My name is Dr. Ajewole from Texas Southern University. Over the next few minutes, I'll be discussing the findings of my study titled Racial Disparity in Oral Chemotherapy Clinical Trials. Over the past decade, there has been a consistent increase in the FDA approval of chemotherapy agents in oral formulation. Unfortunately, there is still a huge disparity in the existence, both occurrence and mortality rates of certain types of cancers among minority population. With this information in mind, it pretty much becomes imperative for researchers and clinicians to take a closer look at the inclusion of racial minorities in the clinical trials that leads to the treatment options for diverse types of cancers. The objective of my research here is to evaluate reporting of race and inclusion of minorities in clinical trials leading to approval of drugs, oral chemotherapy agents between 2017 and 2019. In doing this, we looked at the data in the FDA database, and we also evaluated reports from clinicaltrials.gov and then compared that with the national database of the SERS database looking at the epidemiology reports of cancer. Our results here, which is shown in figure 1, pretty much shows that there is a consistent level of African American race being majorly impacted with non-small cell lung cancer, prostate cancer, as well as breast cancer. Unfortunately, when we look at figure 2, we look at the representation of this racial inclusion in clinical trials for oral chemotherapy, and we find that only 2.72% of African Americans were included in these clinical trials, and you have about 67% of inclusion being for whites. So there is still an overrepresentation of whites in clinical trials leading to oral chemotherapy. When we look at figure 3 also, trying to have a comparison of inclusion of racial minorities in cancers leading to high mortality rates, we see that representation of African American and Hispanics is very, very low in lung cancer, prostate cancer, as well as breast cancer. Based on these findings, it is pretty much imperative that necessary actions need to be taken, policy decisions need to be reformed that would increase the representation of African Americans, Hispanics, ethnic minorities in enrollment in clinical trials, so that there will be better options, better treatment options available for patients that have diverse type of cancers. And I would like to acknowledge RCMI, the grant U2U54 ND00760-27A1 for their support regarding this project. Thank you and have a great day.